hope that you enjoy your time here with us. The plan is to have very cordial, informal conversations as much as possible with very little formality so that people will get to know each other and to have the useful discussions that should be had so that collaborations and partnerships can be built for the benefit of all in this room. Without much ado, I'll ask Richard Phillips, the Scientific Director at KCCR, to take us through.
All right, thank you very much. I don't know if I should stand. Maybe I stand, it's better. You can see my face. So, on behalf of the chairman, on behalf of the board of the KCCR, Professor JSK, Ayim, and the entire board, and the scientists here, the PIs, we wish to welcome Her Excellency Katharina Fekiband and the High Science Delegation. And we are really pleased to have you with us. We've long looked forward to this visit. It was at the 25th anniversary that we heard rumors that you were coming, but it did not happen. But it's never too late. You are here to see the project that you started. So we want to say a big welcome to you. The whole KCCR say Akwaba. Akwaba means you are welcome. And wherever you hear it, know people are welcoming you. That's the way we do it. So we are pleased that you can make it out of your busy schedule. And it tells us the sort of value that you place on this project, KCCR, because you could have visited other places, but you knew that KCCR should be on your itinerary. And you did not come alone, but you came with a mix of expertise. And our scientists are also all here, ready to interact with you. So we are really grateful that you've been able to make it. We are hoping that in the next phase of our lives as KCCR, we will be able to chart a new path, looking at new ways of doing things, and also whet your appetite in pushing more funding and ideas our way, KCCR, as jointly we work together to achieve our goals. Today, you'll get to meet our scientists. They will present some of the things that they've been doing, look at their successes, look at areas and synergies where we can change direction, where we can add on new ideas. That is what we are looking forward to. And so we are really pleased. I won't go on talking. There'll still be more that you hear from us about the history of KCCR and where we have come from and where we are going. So I really want to say thank you very much for coming. It's a really big honor for me to be doing this. Thank you. Good morning.
Yeah, maybe I also walk up to the front so I can see you better and you can see me better. Unfortunately, our delegation failed to wear the same clothes. I just learned, and I very much like the idea, maybe this is one thing to take back home with, that Friday, not only here at the KCCR, but in general, you have the one cloth day or same cloth day. So you wear the uniform, going back to like a tribal tradition, which you picked for the KCCR, and I think it's wonderful. So we will probably wear different uniforms because we come from politics, but also administration from my ministry, and then we have universities on board, and of course world-class, high-class research institutions from different fields, but it shows the spirit with which we are here, the spirit of interdisciplinarity, of curiosity, and of course of love for science and research from all different perspectives. And I think this is something, the strong bonds and the cooperation between KCCR and Hamburg and the Bernhard Institute are really based on. So it's a privilege and an honor for us, for me to be here. In fact, I was very sad when I couldn't come to the anniversary, and you just put, as we say in Germany, some salt in the wound. But now I'm even happier to be here, not just by myself, but with a great bunch of people, a great bunch of scientists, as I said, from different universities and research institutions. And we are driven by joy and curiosity, not only to look back on what you've achieved in this long-standing cooperation, but also put our heads together and think about new ideas and how far we can tackle the great challenges of mankind these days, climate change on the one hand, but also the rise of epidemics and infectious diseases, and how to heal them, how to find therapy. About in the short welcoming speech, because the topic of digitization, the topic of data and how to store data and share data and use data, big amounts of data, in order to tackle diseases in this region, but also all over the world, is for us of very, very big importance. So let's see what we're gonna do, and I'm very much looking forward to everything that is coming up the next hours. We're very much looking forward to the day here with you. Thank you so much.
Thank you very much, Your Excellency Foreign Minister. The scientific director would have some presentation for us, but briefly I must mention that the board chair of KCCR, former Vice Chancellor KNUST, Professor JSK Lim, is here with us. So that's Professor Lim. He was Vice Chancellor at a point when I was a student under him. From time after he became Vice Chancellor. Prof, welcome. Then my boss, who I work under, Provost of the College of Health Sciences, Professor Ajayi, is also here with us. We have lots of the scientists here, but I'm sure their introduction will come when they are seeing their posters. But Director International Programs Office, Professor Gia, is also here with us. Prof. Yeah. So the PIs, I think that your intros will come when you are about to do your process. So Scientific Director.
All right, so we don't have a lot of time, but I'll try and do this as briefly as possible so we'll have enough time for interaction. I'd like to provide a little bit of an overview of where we have been or where we started from, because there are many who tell me they don't know the story. So I'll try to do that briefly to put everything into context. So I'll provide some historical perspectives and our future outlook for the center. So, how did KCCR start? So there was an idea that a research center was going to be built. The German ambassador approached the Vice Chancellor of KNUST, and then Professor Dr. Brobe and the team from the Bernhard Institute put together put his signature to it, and the deputy mayor, Professor Dr. Erhard Ritterhaus, signed the state agreement on behalf of Germany. And so that was how come this was set up. And the agreement was unique in the sense that and it's on the basis of the state agreement that the center is operating. But the beauty about it is that KCCR, after the collegiate system was established at KNUST, became the research center for the College of Health Sciences. So we do have a place in the organogram of the KNUST. Yes, and the idea behind setting this center up was to set up a platform for multinational scientific collaborative biomedical research. So you see when we go around that we go labs to the platform is there for all scientists to come in to be able to carry out research to the best of their ability and to contribute to human capacity and also facilities or technical facilities for the purpose of science and to conduct research, both basic, applied, implementation, research, and research of all sorts. So those were the broad objectives of the center. And the other beauty about this setup was that KNUST provided 2 representatives by the state agreement to serve on an advisory board. The Ministry of Health nominates the chairman for the board after suggestion from the advisory board, and the KNUST Institute was also to provide 2 members to serve on that advisory board, and that board was made to regulate the activities of this center. And so that was the beauty of it, with the partnership. That's how it was set up. And so the so the initial computers and others were for science to be carried out as a starter, initial premises. And then the project had to continue, and so this is where we are sitting currently. This is how it all looked like at the time. It was a big forest, this place, and the land was cleared. In 2001, the sword cutting took place, and the Volkswagen Foundation provided some money to construct the original buildings for use. And in 2003, the original buildings were completed. It was L in shape. At the time, this building wasn't there. It was on the 14th of November 2003 that it was inaugurated. And what I need to mention was that one important person here in the building who were there at the time this was happening. And Professor JSK was Vice Chancellor at the period. And also Dr. Thomas Cooper is there. He was Director of the Center. I think he's giving my hand. Director of the Center at the time, actually the longest serving director who supervised the building, made sure things happened properly. He gets a chance to come and visit us every now and then. So that it has expanded. So an entomology block came in because we needed facilities for doing entomological work. So that also came in 2019, 2020. And then after COVID started, further expansion had to happen. And so this building also was constructed because we needed space for biosafety laboratories, sophisticated laboratories to allow us to handle dangerous organisms like COVID at the time and also other dangerous organisms. We had to set up new facilities. It was inaugurated in November 2022 at our 25th anniversary. We did not know how to arrive at those. Now, when we set up the sequencing facility now, we are able to tell all that. Model laboratories for antimicrobial resistance. Those labs are not here. They are, you have to drive a bit into the districts. We have one at Agogo, there's another one at Asimfosu, and there's another one at Agroyesu. So the idea was setting up these labs to be able to provide data on antimicrobial resistance. And so that we found it as a very good step, and that also happened in 2019, 2020. Bridge the gap in capacity, because we know Ghana was struggling with capacity building. So the idea was to ensure that we train people to the level of PhDs, high-level training to be able to go into research leadership and to mentor other researchers. And so that business we have been in, and there's been a lot of North-South collaboration in trying to build such capacity over the years. And I'm proud to say that we have achieved a lot of that, because there are a lot of the scientists sitting in the room presently that benefited from that training. And so you can see we have here Professor Deborah. Professor Deborah is now the Dean of the Faculty of Allied Health Sciences. Professor Deborah is here. He had his PhD training on this program. We have Dr. Linda Deborah is also sitting here. And now all of them, they've gone into research leadership and to be principal investigators in research. And Dr. Charity, we have Charity, where are you sitting? There you are. And we have Anthony. Anthony is sitting somewhere there in the corner. And Dr. Michael Frimpong. Michael Frimpong, where is he? There is he. So we said Dr. Michael Owusu is also there. Dr. Alex Kwarteng, have I seen him today? There he is as well. Silva King, where are you? Oh, there she is, over there, Dr. Ernest Adankwa. Yes, so you can see that there's been a lot of productivity, and the beauty about it is that most of them are leading big research groups. It's not just completion of their training, but they are the cornerstone of this center, because all the students, most of them have students, some have groups as big as 30, 40 people working under them and training the next generation of scientists. So that has been the focus of KCCR, and the good thing is that a lot of them also transition in having lectureship positions at KNUST, and so they also teach students there as well. KCCR has been quite productive, and you can see from this graph that there's been a steep rise in the number of publications we are doing and putting out currently, and that has really changed since the last couple of years. KCCR has also got to be known in the news because of the service we provided to the community with respect to COVID-19. COVID-19 was what put KCCR in the news, and so after that, when the monkeypox came through, we had to be called on to get accreditation to do monkeypox testing as well. We also provide data on influenza outbreaks, and we also work with the national program for TB, providing TB diagnostics for about 6 regions in the country. We serve the data to the national programs, and also work with WHO in diagnosis of skin-neglected tropical diseases. So it's been very interesting, and during COVID, this photo was taken at the beginning of COVID in March, when the outbreak came up in Ghana, and that was the team, and Dr. Silva King and Michael Owusu, they put their team together to start the diagnostics, and then it grew, and then it grew. And then that's Michael, when he set up these suitcase labs, portable labs for us to take to a point of need to patients in remote areas to have diagnostics done. And we also coupled with or worked with the Ghana Revenue Authority and GIZ in signing an MOU to use their custom mobile labs to send diagnostics to those that were in remote places. So I hope this will play. This is a short. When the COVID started, we realized we had to learn other skills, sequencing. And so we had to work with our Northern partners in Germany to help us to set up the sequencing. So this is a short video of what was put together and what was done at the time in setting up the sequencing for us to be part of the game. So just brief quite brief. So that's the end of it. So these were the institutions KCCR worked with in getting the sequencing set up. So there was a team put together by the German epidemic response team to help us in setting up the facility. So there's been contribution from different people in bringing us where we have been. And KCCR have had awards. I mean, I'm privileged to say, I'm proud to say that we've won the best had visits from Germany, visits from renowned people, WHO, UNICEF, yeah, and I'm sure you can recognize some of the faces. The president visited us, he came here, we had calls, he was coming, the next day he was here to visit us, yes. It was a big surprise, but then we had to receive him, take him round for him to see what we've been doing here in KCCR. And at our 25th anniversary, the Ashanti chief decided to be here. And he did not just attend, he decided to make a donation of 1 million Ghana cedis to KCCR to carry on doing his research. So that was also remarkable. And in KCCR, our core business is carrying out research. And so this slide sort of captures the groups that work in KCCR. I'm not going to speak to all of them, but you get to interact with them because they are all here. And they decided, because of time, to put up posters so that you can speak to them and they'll tell you what they've been doing individually. Basically, there's a lot of focus on neglected tropical diseases, filariasis, and skin-neglected tropical disease for neglected diseases. Infectious disease epidemiology is also key. One Health virology, One Health bacteriology. One Health is big in KCCR. So these are also, and also global health, because we realized along the line that we need to think global. And so we have a group on global health and infectious diseases. And there's vector-borne infectious disease and vector biology, the leads are here, and also understanding mycobacterial disease, particularly TB, and also a bit of non-communicable disease and the host response to them, and a bit of bioinformatics. And I say that some of the topics have not been well developed, but we are looking forward to developing them. And the other thing is contributing to clinical trials all over the world that have changed policy. And so that business KCCR we've been in. So clinical trials ongoing, we work with the FDA in Ghana in carrying out some of these trials, and a lot of them that have already been carried out have led to change in policy in health, yes. Our research goes really far. It's not just in this building. We carry out most of the work in really remote areas, and you see what happens when they travel to some of these distant areas, some 500 kilometers away from here, very rough terrain we have to work in. Sometimes the vehicle, even land cruisers, get stuck, giving you an idea of the sort of terrains we have to go and work in. And some of the PIs will have their stories to tell you. In terms of funding, we get funding from the Bernard Knott Institute in terms of research, bringing research funding in together with them. We also get other third-party funding, and KCCR also tries to generate its own funds to keep the center going, and the government of Ghana also gives us exemptions on taxes, etc., to keep the center functioning. And so KCCR has been seen as an example of sustainable research collaboration for that purpose, and that's what has kept the center going. We do have a bright future outlook. We think that what should be at the center of everything we do is ensuring that we bridge the gap in capacity. There's still a big gap in capacity. The World Bank data and UNESCO data shows that Ghana is still lagging behind seriously with the number of researchers per million. It's 87. If you compare the numbers with other countries, you can see that we still have a shortfall. And so there has to be an effort to increase this, to improve the numbers, yes. The other topics we are focused on is One Health. And this is depicted in the photograph you can see up here that I borrowed from one of the PIs, that shows in some communities where people use the same pots with the animals that live with them at home. So you can imagine how diseases can pass on between them. So One Health for us is very important, and we think should be the focus of our research looking into the future. antimicrobial resistance is a big topic, and it is also our focus for the future. The other topic is making sure that we are prepared for the next outbreak. We don't know what the next outbreak is going to be, but trying to put in all that we need to be ready. The other thing is going the last mile, because one of the neglected tropical disease is so rife and so much in the area where we live. And so it's a priority topic that we cannot ignore. And we need to put in all the effort and do all the research in trying to bring care to the last people and those that are the last now. We think that in doing this, we need to do our research also differently. We need to focus more on interdisciplinary research, thinking intersectorially, thinking internationally, not doing things in silos the way we did it probably in the past, but thinking differently. And that is the focus for tomorrow. And I think that is one of the discussions we're going to be having, looking at how we can get expertise from different areas in making sure that we deliver the best of care to our sick patients. And how to bring it all together. If you're working with all different groups of people, how do you bring everything together? How do you bring the data together? That is a topic also for discussion. New skills are needed, new technologies are needed in bringing things together, new communication skills are needed, new collaborations are needed, and so KCCR is really open to such collaborations. Yesterday we were having discussions with those on the climate and other places about new things that can be done with them in terms of research. Above all, we want to stay in the lead. We don't want to be seen as going down. We want to continue to have our name in the front. And that will always be our outlook for the future. Thank you very much. That is my little story. If there are any burning questions, or maybe briefly I could clarify. So maybe that can happen, I mean, further discussions can happen as we go. So we're thinking that at this stage, all our PIs, they have stories to tell. And lots of them have been waiting to tell their stories. And I think the time is up for us to have a chat with them. And they are ready with posters, beautiful posters, carrying their messages, and they want to discuss what they've been doing. And so I think it's good for us if we can go around and see their posters and have a chat with them so that they realize how important their work is and maybe ask questions about the next steps. And then when we sit down, we can have roundtable discussions after you've gotten a chance to have a chat with them. And so in the next stage, I would ask that the PIs, you stand by your posters as our science delegation go around to have a chat with you. You can explain what you are doing. It will give a better overview of what you are doing in terms of science, and then we can have the roundtable discussions, if that's okay. Okay, thank you.
During COVID, we had little bits of money. Yes. If you want to be sustainable, you need to look at all places.
Permanent funding to have all places. And then you can take in, of course, let's be very, it's a difference to our German system, where we provide universities and research institutions with the permanent funding. Of course, the professors and universities, maybe they say it could be more, but I think we provide stable funding so they can rely on it and they know I will have it next month. Yeah. So thank you so much. All the best. Yes, yeah.
So ladies and gentlemen, we have about 7 minutes for this session. I encourage you to move around those see as much as possible and try to keep to the time. Yeah. There's a lot to see. 7 more minutes for the session, so I encourage you to move around with the various seats. And then they sit the So when you know,
not only doing the research and then leaving the people that are about. So I go down.
So it's possible for you to reach the persons in the field, the
farmers, whether the farmers, especially animal farmers, that I work with them, I work with them,
so KCCR will know.
I'll have absolutely.
Always say very short introduction. We give the money and the institutions make the return. So that's our we do a little bit more, but the money is always too short. Our job is to give it in the right direction.
And then I think it's also for us
currently is being eliminated. So we just have even eliminated over 90 issues. It's now only preventing about 6 states. And what we've seen is where transition basically being done.
County.
Well,
the Western region of Wasa, and then in Hamburg.
all the good neighborhoods areas. And to get to the last or get to
Yes, so we are already.
And that one is important. Otherwise,
And the name and the accent as well. Yeah, so in Spain, for example, we have had
Romani?
Yes, still from Ghana.
Oh, not Ghana.
Yes, 10 years in Ghana.
Oh, you are more of a Ghanaian. I'm very realize that.
Ladies and gentlemen, I see you're having a good time by your good side. As we normally time to share, we stay within time. Thank you very much. Everyone, resume your seats in the next 20 seconds. Ladies and gentlemen, you can take your seats in the next 20 seconds so that we
While the scientific director was making the presentation, I took a snapshot of his slide and sent it to Dr. Brookman Emisa. And she said, wow, a younger version of myself. She was excited about it. But I think it's really important, the delegation being able to come here to KCCR, because what that does is to give you a throwback to see the impact of a calculated, you can call it an investment, right? A calculated investment in science and what the products of that have been over the years. And with that, I'd like to call on Thomas very quickly, because I heard that you're a historian. I heard you with my own ears. If and I know you can talk for an hour, but please don't. You just have 1 minute. Thomas, just the importance of history, learning from the past for looking forward.
I was a little bit surprised, honored by your invitation to give some comments from a historical perspective. So, introducing me as a historian, you know that I'm not at the heart of infection disease research, but I'm looking for the context of it. Let me make only 3 points. Looking to history gives a kind of an atmosphere of humility. Looking to the history of your discipline, you will see how 50 years ago, 100 years ago, researchers tried to explain what you are researching now. And the history of the discipline is a mixture of failures and errors, and being better, doing research is to work on the shoulders of giants and to try to look a little bit further in how far we can make progress to explain, for example, infection diseases and everything what is combined with that. The second point I want to make, it is very important to look to the political context. Who is going to decide what to do with your insights? Infection disease research is very much in relation to society, to rural society in some way. And there is no pure science, but you are always related to society, politics, and processes you influence by your insights in some way. And the third point I want to make is about communication. You have to think how you can communicate to a broader public. It's no problem to speak to colleagues like our delegation, for example, but how can you address the farmer, how can you address the people in the suburbs of Kumasi, for example, to tell them about your insights and to tell them to discuss the consequences we have to draw from your insights. And that would be the cultural context, the historical context in some way to infection disease research you are doing. Thank you.
Digital health, and then digital One Health, which is very, very important. With COVID and then other viral infections, we recognize the need for us to not only put investment in there, but also the research that will help us. For us, in the college, I will first speak from the college perspective. The center has been doing so well. As I indicated in the morning, COVID showed to us that more from the middle to the northern part of the country, the center was in charge of testing and then collaborating with other sister institutions in the capital, and we managed to go through the pandemic. And subsequently, we were happy to have the GWAC, that is the Center for Global Health and Pandemic Preparedness. For us, the way forward is key, as you indicated. We need to invest in emerging areas, especially combining with technology. I think so. Your proposal or your collaboration is in the right order and timely. And I can say that on behalf of the university, we are ready to collaborate with you in terms of the research that will go into it. For the meantime, we have, I would say, few individuals and then researchers involved in that. So taking off with such a collaboration won't be difficult. We'll be able to live up to expectation, and I believe that in the next 20, 30 years, we'll be celebrating the same as KCCR based on your initiative. Thank you.
Well, thank you very much. The last person I want to throw under the bus is Jürgen Mai. Jürgen has been with us for a long time here at KCCR over the years. I see him at the time. I think I was a medical student, and then the KCCR was at the medical school. Weekends, I see the KCCR cars going and coming. Little did I know that I would be in the thick of affairs as part of my later life. Reflections from your perspective over the years and where we are now. Now this desire to have something new around digital health. Where do you see how KCCR can be complementary? The KCCR fraternity can be complementary to this.
Yeah, thank you, John. It is always a pleasure to be here for me. And as far as all people sitting here in the room, I know since a long time. I'm very glad to be here with the Hamburg delegation, with high-level representatives from the universities and non-university research institutions, including the minister, who have missed this great 25 years anniversary. And in this case, you would, okay, again, I don't want to, I didn't want to put more salt in, but then you would have seen hundreds of these during this celebration. But it is great that you are here, and this gives you more the opportunity to focus on what is KCCR doing. And it is not enough time, that's clear. But maybe this gave you a glimpse of what KCCR is doing. And for me, it is really always fantastic and surprising how KCCR has developed from Thomas' time to now. And so really from a very small unit of the university to what we can see here. And this was only possible with a lot of engagement, with support of the university, also support from our funders of BNITM. And I think the structure, the principal idea written in the state agreement was a very good one. And always, as we have discussed, always you need also some luck, but you need the people who are engaged, who believe in such an endeavor, who have a perspective or see a perspective. And I think this was the case in the future. If KCCR continues with this way, I don't know, then I don't know where the KCCR can be in 10 or 20 years. But I wish KCCR luck, and I think it's embedded in the KNUST, and also for KNUST, there was such a development over the last 20 years. It is really unbelievable. When we started, it was nothing about nothing. Big campus, so big, but it was really a great development, and I think it is not the end of this development. And you have mentioned the computational sciences. So we have some opportunities to develop this in our institute, but also in Africa. partner. I think this is the same where in the beginning of the 90s with the molecular biology. So this was really a game changer. And sciences, computational sciences in research is the same fundamental change, and it is good to be there. And this is an additional chance also for African countries, and KCCR and KNUST are in a good pole position for that, really to take part in this development. It gives you the chance of leapfrogging and other positive developments. So I wish you a lot of luck for this way.
No, thank you very much, Jürgen. Time, but if anyone has any pressing further remarks or comments, I would open the floor. Back to you, Yao, and thank you very much.
Thank you very much, John. Very well done. And thank you. I didn't have to remind you of the time and the headmaster. So thank you for being a gentleman. So we are almost there. We're going to move down to have a guided tour of the KCCR premises. But once we go down, we'll take a group photo. Guys, where is that going to be? In front of the guest house. So we'll walk straight out, down the stairs, and to our left. We'll take a group photo there. Guest house. Jürgen and Marlon and the rest know that place very well, but I'm sure you'll guide Minister and Clara. We don't want her getting lost and found. Remember, I used to be a forest. Yeah, we'll go. The room is secure. It's a forest, but the room is very safe. You can leave your stuff here so that we don't want all of the other things appearing in the photo. Yeah? Hetty and Jutta will make sure that it's safe. So we'll go down, take the